Normally, after the radiotherapy session, the patient generally do not feel anything because it is just like an X-ray where the patient actually do not see where the radiation coming in, they do not feel it, so there will be no pain or any burning sensation. The side effect will only come in after the patient actually had multiple sessions delivered to the same site over a course of a short duration. Then that's when some of these side effects might start to come in. If the radiation is given to the scalp area, then yes, the patient might lose hair. But if the radiation is given to other parts of the body, no, normally the patient will not have any hair loss due to that. If the patients do not suffer from any side effect and they feel well after the radiation treatment, they can actually go about to have their usual activities. It is always good for the patients to come with either their family or friends because we will never be able to expect what are the side effects that the patient is going to be encounter during each session. So therefore, it's always we encourage the patient to come with a company, friends or family. And I think it's also good in the sense that besides accompanying the patient, they are also there to give the moral support, to the patients that they are undergoing the treatment itself. Again, if the patients feel well after each session, patients actually are encouraged to go to work unless they actually suffer from the side effect where they actually need more time to rest and recover. Then it's better for them to rest after the treatment. But if let's say they do not suffer from any of these side effects and they feel well, they actually can go to work. Yes, radiation therapy doesn't cause any radiation being emitted by the patients after the session. So actually it is safe for the patient after the radiotherapy session to be with the family, to sleep in the same room, to eat together with them, or even to mingle around with the children. Generally, the patient would not be more susceptible to infection during or after radiation therapy because radiation therapy generally do not cause the patients to go into immunocompromised state, or that means that their immune system doesn't go down because of the radiations. Unless the radiation is given together with chemotherapy in certain conditions, then yes, the patient might actually be more susceptible to infection because of the chemotherapy causing their immune system to go down during that short durations. So radiotherapy, like most radiation, right, can potentially cause a secondary cancer, meaning that a cancer that developed years after a patient being exposed to radiotherapy. But based on the data or research that was conducted, generally the risk is very, very low. You are essentially looking at something like a 1 to 2%. Of course, depends on when the patient actually had the radiotherapy. The younger the patient actually had the radiotherapy session, the risk of them developing the secondary cancer will be higher compared to someone who are in their elderly when they actually receive the radiation. Generally, the patient will not set off the airport security alarm after radiation treatment because, like I mentioned earlier, after the radiation, patient generally are like a normal person, where they actually is safe for them to actually to stay in the same room with their family members, eat together, and hence there's actually no radiation being emitted out from their body, and therefore they wouldn't set off the airport security alarm because after the radiation therapy. Normally, we do not encourage the patients to take supplements or vitamins during the treatment What the patient really needs is actually a balanced diet with adequate calorie and nutrients so that they can actually undergo the treatment without much of a problem. That is because sometimes some of these vitamins or supplements, they contain certain ingredients which was not exposed or being declared, and hence they can potentially affect the treatment that we are giving to the patient. I think generally it is very important for the patients to be aware of their own conditions, because we tend to actually compare, with hearsay or some other people, what has been done or what are the side effects they have suffered and all. I think it's always very important for the patient actually to know their own situation, because everyone is actually different, and the treatment that is being delivered or suggested to them might be different as well. So always talk to your doctors based on the condition, what will be the side effects of the treatment that the doctor suggested, as well as to what are the advice that you can get from the doctors to minimize the side effect so that you can actually safely undergo and finish off the treatment, and cure off the disease.